Good day everyone. I am your discussant for today and we are going to tackle about the speech and language disorder. Speech and language disorder is a kind of communication problem, which means that a person may have trouble in speaking clearly, understanding what others say, or using their mouth muscles properly for speaking or even eating. According to the study of IDEA, speech and language disorder includes impaired articulation, stuttering, language impairment, or voice impairments, which affect the child's academic performance. So the SDL or the speech and language disorder have are classified into two, which is the first one is the speech disorder and the second one is the language disorder. So when we say speech disorder, it refers to the problem in voice quality and struggles in producing speech sound. So we have the three classification or three symptoms of speech disorder, which I known as ADV or the articulation or phonological disorder, and disfluency or stuttering, and also we have the voice disorder. So in articulation or phonological disorder, it is a failure of development of expected speech sound that is appropriate in their age and dialect. For instance, instead of saying red, some child said it like a wed. So we have the second symptoms of speech disorder, which is the disfluency. Disfluency is also known as stuttering, and it is a speech problem where a person's speaking flow is interrupted. This means that they may have a trouble in speaking smoothly or easily. Their speech may be stopped, repeated, or slowed down in ways that are not typical. In this fluency, it includes the following, which is the sound and syllables repetition. And for instance, saying instead of saying "I want that," some say I want that. There is a repetition in a sound or a syllables. We also have the prolongation, the broken words, audible blocking, silent blocking, and hesitation. So the third one is the voice disorder. A voice disorder happens when a person's voice sound different from what is normal or expected. It can make the voice hard to understand or uncomfortable to listen to. This can affect how a person communicates in daily life. So there are three main areas where problems occur when it comes to voice disorder. The first one is the pitch. Pitch is how high or low a voice sound. It the voice might be maybe too high, too low, or flat, or what we call the monotone. Another one is the loudness. So the voice might be too loud or soft. And the last one is the quality. This refers to how the voice sound overall. So, in short, a voice disorders affect how the voice sounds, not the words being spoken. It can involve problems with pitch, loudness, or the overall quality of the voice. So let's just all always remember that when a child or a person are diagnosed with speech disorder, which or to the symptoms, which is the ADV, they always struggles to say the word or to say it right, say it fluently, and say it clearly. So now let's move on to the second classification, which is the language disorder. A language disorder is when a person has a trouble in understanding others or expressing their thoughts clearly. A language disorder affects how someone learns, understands, and uses language in their daily life. So we have the three types of language disorder, which is it stands for REM, which is the first one is the receptive language disorder. So when we say receptive language disorder, it is when a person has a difficulty in understanding what others sayings. And they may also struggles to follow directions, answer questions, or understand stories. And the second one is the expressive language disorder. So it is when the person has a difficulty in expressing their thoughts, ideas, or feelings. This may use short or incomplete sentences. They may use short or incomplete sentences rather, and have a limited vocabulary or struggle to find the right words. So the last one is the mixed receptive expressive language disorder. It is the person has a problem with both understanding and expressing language. So the mixed repetitive expressive language disorder is a combination ex- of expressive language disorder and the receptive language disorder. And now let's discuss about the causes of speech and language disorder. So the first causes of speech and language disorder is the congenital malformation. Congenital malformation includes conditions present at birth such as prenatal injury, tumors, or issue affecting the nervous or muscular system. So the second one is the exposure to teratogens. It is a harmful substances or agents like X-ray, certain viruses, drugs, and environmental toxins that affect fetal development. So the third one is the German measles, which is it's also known as rubella. It is a viral infection during pregnancy that can affect the developing fetus and lead to hearing loss or other developmental issues like uh, speech and language disorder. So the fourth one is the traumatic brain injury, or what we call TBI. It is a damage to the brain from accidents or injuries that can impair communication abilities. Another one is the meningitis. It is a serious infection that affects the brain and spinal cord, potentially leading to speech and language difficulties. Another one is the abnormalities in respiration. It is a breathing issues that interfere with the ability to produce clear and consistent speech sound. We also have the limited tongue mobility, which is a condition like tongue tie, or what we call ankylosing that restrict the tongue's movement and affect articulation. And we also have the cleft lip or cleft palate, which is the opening or splits in the lip or roof of the mouth that interfere with sound production and resonance. And the last one is the craniofacial malformation, which is a structural abnormalities of the face and skull that can impact speech development and clarity. So we have here a two school-based program which is designed in order to help the teachers on how they deal with the students or with the children that had a speech and language disorder. The first one is this discrimination activities. So in discrimination activities, it helps a child learn to hear the difference between speech sound. This is important because to say words correctly, the child rather first needs to recognize when a sound is right or wrong. So how the In this activity, the child will listen carefully to sound or words. So the teacher or the therapies may use auditory cues or the sound, visual cues or showing a mouth movements, and tactile cues or feeling how sound are made. So the child practice telling apart similar sound like knowing the difference between but and pot. So, the main goal of discrimination activities is to train a child to become a more aware of speech sound, which is the first step to fixing how they speak. The second one is the production activities. So, production activities are exercises that help a child to practice saying speech sound correctly. These activities are done after the child learns to hear and recognize the sound differences through discrimination activities. So after the discrimination activities, the production activities will occur. So in this activity, the therapies model the therapies or the what we call this the teacher model the correct way to say a sound, and the child copies the sound often while looking in a mirror to see how their mouth moves and practice moves in step. And for instance, if a child has a trouble with the R sound, the teachers might show how to say it correctly. So let as a teacher, let the teacher will let the child practice in a mirror, use words like red and rabbit, move on to sentences like rabbit, the rabbit ran. So, in short, the main goal of production activities is to help children practice and perfect how they say sounds, starting from the basics on and building up to real conversation. As I mentioned a while ago, that in the first classification of speech and language disorder, which is the speech disorder, one of the symptoms of this is the disfluency or the stuttering. So, in order to, we have here the strategies that can help the teachers when they are dealing with the children are who stutter. So, the first one is maintain eye contact with the child when speaking. Number two, pay attention to the message of the speech rather than how the child said it. So, we should be more attentive to the message of the speech. Number three, don't give the child a special treatment because of his condition. So we shouldn't, as a teacher, we should treat our students fairly with or without disability. 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 So the number four, as a teacher, we should know the interests of the child so we can encourage him to engage in a meaningful conversation. Number five, let the child talk and do not interrupt him during his time. Number six, allow the child to have a slower rate of speech to give him time to organize his thought. Number seven, model the correct pronunciation, vocabulary, and grammar. So, as a teacher, if you heard your students saying some uh, mispronounced word, we should correct it in a nice way. So, number eight. Use voice recorder drills, and number nine, expose the child to a group activities to encourage him to speak. We have here the language disorder deductive teaching approaches, which is when we say deductive teaching approaches or teaching deductive teaching approaches for language disorders is it refers to structured teachers directed instructional methods designed to support learners who have difficulties with understanding or using language. So these approaches more focus on clear step-by-step teaching and often using repetition, modeling, and multisensory strategies to help students develop their language skills in areas like speaking, listening, reading, and writing. So in this teaching approaches, we have here the um, five approaches. So the first one is unlock difficult or unfamiliar words before reading a story, listening to a song, or watching a movie. So reminder, this approaches is used by the teacher, so we can aid the language disorder that our students have. So the second one is use story and song boards with pictures. The third one is create a word wall rather. Display new words every day. Pronounce, give the meaning and examples. So we should let the children pronounce the word independently and give their own examples. Number four is we should use graphic organizer and mnemonic devices in learning new words. Number five, encourage the use of journals, email, and social network sites to develop their real-time language skills. We also have another intervention that we can use in order to deal with students that have a SLD. This intervention is known as naturalistic intervention or milieu teaching. So, naturalistic intervention is a communication teaching strategy which is used primarily by speech and language pathologists and teachers in helping the children to develop their language skills. So in this approach, the teacher will use natural, so from the word itself, naturalistic. So instead of structured teaching, the teacher will use a natural or real life setting like classroom, home, or the playground. So the main goals or the primary goals of naturalistic intervention is to exposing the child to a different experiences, situation, people, and other stimuli that can encourage him to engage meaningful conversation. So in this intervention, the socialization, so letting the child to socialize with their peers, with their family, or anyone that can help them in order to improve their conversational skills. We have here a different suggestion of how to create an interesting learning environment for students with SLD. So the first one is we should provide an interesting materials. When the children are curious, there is a strong tendency that they will ask a question. So for instance, show a students a colorful pictures of books about animals that make sounds. So with this situation, the child might ask what animal is that. So out of curiosity, they will ask about the animals. So with that, a conversation will begin with the child. So the third suggestion is giving a child an opportunities to choose. So, so when the children are given a chance to choose a toy or an activity, there is a likelihood that they will be more cooperative to engage in conversation. Offering choices encourages children to express preferences, and practice communication. For instance, ask them, "Do you want to play with blocks or draw?" So the child might say or may respond, "I want to draw." The fourth one is do something unexpected, like calling him with a different name or giving him a different art kit. So this situation can be a springboard to a conversation. Unexpected actions grab the child's attention and prompt a reaction or correction. For instance, call the child Mr. Banana instead of their name. So they might laugh and say, "Oh, that's not my name." The fifth suggestion is give inadequate portion, like hiding some pieces of puzzles. This can motivate the child to report or to ask for something for the missing piece. The sixth suggestion is that we should provide activities that require assistance, like using a knife to cut fruits and vegetables or opening a container of cookies or popcorn. We also have here the alternative and augmentative communication, or ACC, which is it is a form of communication used by people who cannot speak or have difficulty in speaking, express their thoughts, needs, and feelings. So it is especially helpful for nonverbal individuals or those with speech impairments. So ACC have a two types, which is according to Hayward. So the first one is the aided ACC. So in aided ACC, technique of communication, this type of communication uses a external tools or devices to help a person to communicate. So the first devices, or for example, the devices that they can help them are the pencils and papers, which is identified as no tech or no technology, switches to transmit words and phrases, and computerized voice output technology. So the second one is unaided ACC, technique of communication. So unlike the aided ACC that requires any devices, in unaided ACC it does not require any physical aid or devices. So some example are oral speeches, gestures, facial expression, postures, and sign language. So here in the Philippines, as we all know, the using a high tech or low technology is quite expensive. So we have here the steps that we can use in developing an improvised no tech ACC system. So the first one is compile an augmented vocabulary of a child. So the vocabulary will be coming from the one that the child is already using in all situations, from peers, teachers, and parents. Number two, develop a collection of symbols or pictures that represent the child augmented vocabulary. Words may be included to level the symbol or picture. Number three, create a communication board. So this can be an illustration board or any flat surface on which the symbols are arranged and attached for the child use. Number four, provide a situational board that can be used by the child in a particular situation, like in restaurants, mall, or classroom. We have here a four major types of SLD, or speech language disorder. So the first one is articulation, which is a speech impairment where children produces incorrectly. For instance, like an L or the R. So example, the word red, instead of red, they pronounce it as a wed. So number two is fluency. It is a child's flow of speech is disrupted by sounds, syllables, and words that are repeated, prolonged, or avoided, and where there may be silent laugh or inappropriate inhalation, exhalation, or connotation pattern. The third one is the voice, which is a speech impairment where the child's voice has a abnormal quality to the pitch, resonance, or loudness. Number 4 is the language. Language impairments is when the child has a problem in expressing their needs, ideas, or information or understanding what they hear. We also have the characteristic of language disorder. So the first one is inability to express ideas clearly. So the child may struggles to communicate their thoughts, needs, or feelings effectively. The second one is improper use of words and their meanings, which it is words may be used in a wrong context or misunderstood entirely. The third one is difficulty in following directions. So the child may have a trouble in understanding and carrying out spoken instruction. The number 4, it is a inappropriate grammatical patterns, which is sentence may be formed incorrectly with errors in tense, words order, or sentence structure. Number 5, it is number 5, the limited or reduced vocabulary, which is the child may use fewer words than peers or the same age. We also have the factor that may cause speech defect. The first one is the intellectual disabilities, which is this refers to the delays in cognitive development that can affect language acquisition and speech clarity. Second one is hearing loss. It is a difficulty in hearing sounds correctly that can hinder speech development and pronunciation. Third one is the brain injury, which is a trauma caused by a trauma to the brain may affect areas responsible for speech and language. Number 4, it is a neurological disorder, which is a condition like cerebral palsy or muscular dystrophy can interfere with the muscle control needed for speech. And number 5, we have a drug abuse. So it is a exposure or too much exposure to drugs, especially during pregnancy, that can affect a child's brain and speech development. We also have the cleft lip or palate, which is a structural abnormalities in the mouth can affect sound production and clarity. Number 7, on the last one, is a vocal abuse or misuse, which is an excessive shouting, talking, or improper voice use can damage vocal cords, leading to voice and speech problems. So that's all about our discussion for today. Once again, I am your discussant, Vinya Tindu. Yeah.